So the last few years, we've seen a huge amount of growth in both the genetic testing technology, the knowledge of genes, and thus what tests are available to patients. So let's start with the thing that you're probably wondering. If I already had genetic testing, is there more available now? And the answer is there probably is. So if you've had BRCA1 and BRCA2 testing previously and it was negative, there may be more options now. There's been a lot of research going on to find out what are additional answers. So as a genetic counselor, I saw many patients that it just seemed like there was something genetic in the family, and we did the testing and it was negative, and just that uncomfortable feeling of what am I missing? A lot of researchers and other clinicians felt the same way, and they've been studying additional families, and there are a lot of other genes that we've now found out about. Those genes aren't as common as BRCA1 and BRCA2 on their own, but we know about at least 10, 15, 20 additional genes that together, when we look at those genes, we're finding a lot more answers. So how can we look at that many genes at the same time? That's where the genetic testing technology changes come into play. So there's this whole wave of what's called next generation sequencing. If you Google next generation sequencing, you'll get lots of really technical information, and in all honesty, sometimes it even confuses me. The important thing to know is just that the technology is evolving. Think about with cars, how we have forever and ever, we've had cars that ran on gasoline. And now that technology is changing. We have hybrid cars, we have electric cars. Same type of things going on in genetic testing. We have new technology that's been very studied and tested, and it's at that point where it's moving from being researched into being available for patients in clinical genetic tests. And this next generation sequencing, it's kind of like a genetic test on steroids, where you can look at a lot of genes all at the same time very quickly and find answers much more rapidly than we could before. So before, we would have to do 1 or 2 genes at a time, and it would take a couple of weeks. So you would do the first ones, and maybe there would still be more genetic testing. So then you would do an additional one, and it would add a couple of weeks each time. Now, we can do a shotgun approach where we can test all of them at the same time and find more answers quickly for patients. So that's what's going on in the technology realm, is this next generation sequencing. And so what genetic laboratories have done is they've looked at the literature and they've said, okay, what are the other genes that have been found and validated to be associated with breast and ovarian cancer? And there's a lot of them, like I said earlier, 10, 15, 20. And so using this next generation sequencing technology, they can design tests to look at all of those genes at the same time. So there's options available now, and definitely worth having a conversation with your doctor, or if you saw a genetic counselor before, with your genetic counselor about this new panel testing to find out, can we look at other things? Can we find other answers? And it's a very exciting time in genetics for that reason. I think a lot of people look to genetic testing to find answers, and healthcare providers that are ordering genetic testing are hoping to find answers, and we're currently in that phase where we're finding more answers. We're giving more information to patients and their family members so that they can really tailor their healthcare. They can be proactive, and they can give that information to their family members to help them be proactive as well.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.